What about Tylenol, ibuprofen, things like that?
Ibuprofen is not recommended, and the reason why it's not recommended is it can actually impact your platelet function, and so we don't want you to be taking ibuprofen. The Tylenol issue is an interesting one, and I'm going to say that the ACOG guidelines have always recommended, and I'm going to use the correct word, acetaminophen. That product you want to use if you have a significant issue for pain or fever. It's not meant to be used lightly. It's meant to be used judiciously, and you want to use it at the lowest dose possible. But of all of the pain medications, it is considered the safest. You always want to talk to your doctor if you're having a problem, but there are situations where you may need that medication. The interesting point that I want to make that I think doesn't get is that fever during pregnancy is potentially a problem and can impact the fetus. And so a lot of times people have fever because they have an infection. And so the infection can actually cause different developmental outcomes depending on the stage of pregnancy that you're at. So the infection as well as the fever, because you don't want to cook the baby. And so that's why we don't recommend hot tubs at high temperatures. So we don't want to have fever in pregnancy. We don't want to have infections in pregnancy if we can avoid it. And again, these things are sometimes unavoidable. But interestingly, that's when you're giving the Tylenol. So this is not a causal situation. So if you're looking at, is there an increased risk of, whatever you're looking at, if you're looking at autism or other neurodevelopmental outcomes, it may be the situation that happened in pregnancy that led to it. And then all people are talking about is the medication, but there is not a causal relationship.
Yeah. So let me make sure that I'm digesting what you're saying the right way. Very interesting that it doesn't feel like we're actually getting a black and white answer here. It is, hey, during pregnancy, you want to be avoiding painkillers if possible.
Of course.
If you do need to take one because, you are going through XYZ
Or have a fever,
then Tylenol is safest. Mm-hmm. But the way you think about Tylenol as someone pregnant versus someone not pregnant should be very different.
Correct.